Welcome, and thank you for taking the time to watch this video, which has been developed for social work students and social work educators who are interested in learning about evidence-informed social work practice. It may also be of interest to all qualified social workers and social workers completing research. The information referred to in this video can be used across children's and adult social care and in any setting that social work is taking place. I'm Charlotte Goulding. I'm a social worker and I work in the social care team at NICE. In this first video, I will discuss what we mean by evidence and why this is important for social work practice. So let's start by thinking about why social workers need to think about evidence. Social Work England, the professional regulator for social workers in England, sets out professional standards for safe and effective practice, which social workers must follow. The standards referred to in the first box on this slide show that social workers need to be accountable for the quality of practice and the decisions they make by using different explanations and evidence to inform their decisions. Social workers also need to use supervision and feedback to reflect on learning needs, including how research and evidence is used to inform their practice. The British Association of Social Workers, which is often known as BASWA, is the professional association for social workers across the UK. As a professional association, BASWA is a member-led organisation which promotes the voice and contribution of the profession, the interests of those working within the profession, and public interest. BASWA is the custodian of the Professional Capabilities Framework, which defines the professional capabilities that social workers in England need to demonstrate at the 9 different stages in their career, including pre and post qualification. So the second box on this slide refers to the BASWA's Professional Capability Framework. This also refers to the importance of using evidence in practice. For example, for students reaching the end of their first placement, they should use a range of information to inform their decision-making. When I worked as a practicing social worker, if I had a complex situation, I would talk to my colleagues and their experience and expertise would inform my decision-making. Whilst practice wisdom is very valuable, it's also important to use a range of information to support the people we work with and to guide how decisions are made. This slide explains what we mean by evidence-informed practice. The box on the right shows that asking about a person's values and preferences is key. We may also look at their case records and any advanced care plans they have made to find out what's important to them. The box on the left shows it's also important to think about the best available evidence. This could be a range of reports and information about the person. It could also be evidence-based guidance, which explains what works best in practice. NICE guidance could be one source of information for a social worker to consider. The box in the middle shows the importance of using professional judgment to appraise all relevant information and to support decision-making. To explain what evidence in practice means, we have created some fictional scenarios which show how social workers could use NICE guidance to support their work. A range of scenarios are linked to the NICE website under the webpage titled Using NICE Guidance in Social Work. In this scenario, the social worker uses NICE guidance to strengthen their practice during hospital discharges. As NICE guidance is well understood by health colleagues, using NICE recommendations gives parity to the social care model and strengthens the social worker's professional power. If you are interested in learning more about NICE guidance, please see the second video in this series. Social workers that we have spoken to have told us that they have used NICE guidance in a number of ways, as outlined on this slide. Social work students have told us they refer to NICE in their assignments as a source of evidence. Here are some quotes from social workers who use NICE guidance in their practice. The quotes on the left are from a social worker who is working with a woman who had been diagnosed with dementia. She used NICE recommendations about advanced care planning to start a conversation about her future wishes. The quotes on the right are from a Mental Capacity Act lead who used the NICE guideline on decision-making and mental capacity to complete a local audit about mental capacity assessments. Here's a list of the references we used for this section. Thank you for watching this video. If you would like to find out more about how NICE can support social work practice, you may also wish to listen to our next 3 videos. The second video is about how to use the NICE website. The third video is about the range of NICE resources you can use in your practice and for your CPD. And the fourth video is about finding the evidence behind NICE recommendations. It also includes information about how to find the research recommendations made by guideline committees.